I'm sure a lot of us are familiar with the thyroid, but maybe let's go into a little more detail as to kind of how it functions in the body and its purposes.
When we think about the thyroid gland, this is our main metabolism gland. And so we need this hormone to circulate throughout our body, essentially for us to make our energy molecules properly and to kickstart metabolism. So it's really, really important for energy throughout the day. It's important for us to maintain our weight. And is important for us to be able to actually make all of our other hormones too. So this is kind of a governing hormone for overall metabolism, is generally what I say for thyroid.
So for a lot of people that have thyroid conditions, it seems it's like almost every female that I talk to, much more common, I would say. Mm-hmm. But what are some of those symptoms that someone might notice if their thyroid isn't functioning properly?
Totally. So there's two different things with thyroid. We have either hyperthyroid, where there's too much thyroid hormone floating around, or hypothyroid, where there's not enough thyroid hormone. And by far the most common thyroid concerns are low thyroid function, so hypothyroidism. And big symptoms are hair loss. So women will notice, and men too, but much more common in women, that lots of their hair is falling out. Constipation, because you're not metabolizing properly. Constipation is a huge concern with thyroid. Thinning of the eyebrows, especially on the outside, is another one. Recurrent miscarriages for women who are trying to get pregnant, that can be a sign of low thyroid function. Feeling really, really cold, because again, it's that main metabolizer, so it keeps our body temperature high enough for us. So when we're feeling really, really cold or have cold intolerance where we can't handle being out in the cold weather, for example, that can be another sign of thyroid function. And then, of course, the big one, fatigue. Now, fatigue is so common for a lot of people, but thyroid can be a huge underlying reason for fatigue and for just feeling sluggish throughout the day. Sorry, there's so many symptoms for low thyroid, so I'm just going to keep going. But weight gain is another huge one. So because it's that main metabolizer and we're not able to kickstart the thyroid function and have thyroid hormones circulating through the body properly, we can notice that we increase weight. And that's because we're not metabolizing properly. So making those energy pathways. Other side of it is pretty much the opposite. So with high thyroid or too much thyroid floating around, hyperthyroidism, will feel super, super hot, really, really anxious. The heart beats super, super fast. This is a really, really serious condition. You can get something called exophthalmos, where your eyes bulge out. Diarrhea is another really common sign of that. And generally for hyperthyroidism, that's more of a medical emergency, whereas hypothyroidism, these are chronic symptoms that some people deal with for a very, very long time before they're actually diagnosed.
Yeah, absolutely. So what's kind of the difference in between kind of hypothyroidism and Hashimoto's? Because those kind of go maybe not together, but when people are trying to figure out what's going on, are those symptoms common, and what does that look like differently in the body?
Definitely. So with hypothyroidism versus Hashimoto's is the number one most common reason that hypothyroidism can occur. But Hashimoto's is actually an autoimmune condition. So it's where the immune system is actually attacking the thyroid. And so lots of people can notice that their thyroid function is high at a certain point, and then it starts to drop off, meaning that when their thyroid is being actively attacked, they're actually producing a lot of that hormone. And so they get more of those kind of hyperthyroidism picture symptoms that we just talked about. And then it'll slowly regress as the thyroid is essentially being killed into a hypothyroid state. And so they do go hand in hand. It does change in terms of the way that you treat, whether it's a Hashimoto's thyroiditis that's the reason for low thyroid function, or whether it's low thyroid function for another reason.
Yeah. And so with blood testing, like I know a lot of women, especially, they go get blood work and they might just get, your basic thyroid testing. Mm-hmm. And so like you said, a lot of it can go diagnosed. So what's something that maybe we could ask our practitioners for when we want to see like the full picture of what's going on with our thyroid?
Yeah, so this is a really common thing that I talk about in my practice, just with doing really comprehensive testing for thyroid. And that's in terms of the first marker that's going to be looked at is something called thyroid stimulating hormone. And that comes from your pituitary gland, which is a gland in your brain. And that's what stimulates your thyroid to release thyroid hormone. Now, there's two different kinds of thyroid hormone. There's free T3 and free T4. Your thyroid is going to primarily produce free T4, and then it relies on the body systemically or within the bloodstream to actually convert into free T3. Free T3 is the active thyroid hormone. That's what's going to bind in the cell and cause this metabolism to occur. And so there's lots of different steps where thyroid function can be low. So when we just test that TSH or that thyroid stimulating hormone, we're only looking at one piece of the puzzle, right? We're not looking a little bit deeper. And then generally, I always look at antibody production as well. That anti-thyroid peroxidase and then thyroglobulin antibody, which helps to confirm or rule out that Hashimoto's thyroiditis is going on. So generally, by doing kind of a deep dive in terms of what's happening at the brain level, how much thyroid stimulating hormone is being released, and then how much of all of your active thyroid hormones are being released, then you can kind of figure out where in the chain things are breaking down, which then allows for more understanding in terms of if low thyroid function is there, and then targeted treatment in terms of what step in the process is breaking down.
And do you find, because, you know, some of the women that I spoke to as well have gotten a lot of blood work done, like you've mentioned, and, you know, all comes back relatively normal within the ranges that are provided, but they're still having kind of classic thyroid symptoms. Is there still something going on, or have you seen that a lot in your practice as well?
I see that a lot in my practice for sure, where we call it essentially subclinical hypothyroidism, where it's not classically diagnosed through lab work, and it may not require a medication like something like Synthroid or Cytomel, which are really, really common thyroid medications. Right. It may not require something like that, but we need to help support the body with nutrients and potentially some herbs that can help to increase thyroid function. And so that's a big part of patient population that I work with, is that it's potentially not diagnosable as low thyroid or hypothyroid, but it's suboptimal, right? So we're in those lower ends of the reference range. So you're still feeling symptoms of low thyroid function, right? And it's not that you need a medication to change how your body is producing thyroid hormone or to give you the thyroid hormone, but we need to help support the production of that thyroid hormone. And then because all of these symptoms, they're pretty wide ranging, there's lots of different reasons that other things could be going on, right? So potentially some female sex hormone imbalances could be an underlying concern in terms of why there are some of those symptoms that you're experiencing. Potentially there's something going on with that gut microbiome, which we talked about in our last webinar. That can be a cause for some of the symptoms that are considered hypothyroidism symptoms, but they're not within that diagnosable category.
Right. And then do you typically do further testing, or there's more specific tests that you can run on patients?
In terms of thyroid specifically, those are the big ones that we look at for thyroid function. But I generally always look at female hormones as well to understand how potentially low thyroid function is affecting your female hormones, but also if your female hormones are really, really low, that can be the cause for all of those symptoms that you're experiencing, right?
Right.
I also generally look at cortisol, which has a huge effect on thyroid and how your thyroid is actually produced. So cortisol, this is our main stress hormone in the body. It's super important and vital that we have cortisol, but we often have a bit too much cortisol, especially if we're in high stress situations. And so when we're in high stress situations and we're producing a ton of cortisol, that cortisol is actually going to block the conversion of that T4, which is the inactive hormone, to T3, which is the active hormone that can bind the cell. So when we block that conversion because we're under a ton of stress, treating from a cortisol standpoint, stress mitigation techniques, things like that can be vital in terms of treatment of overall thyroid function as well.
Yeah, for sure. Speaking of causes, I guess like the $1,000,000 question, why or what causes hypothyroidism or Hashimoto's? Obviously, you mentioned cortisol, but there's obviously many other factors.
There are many factors to why these things can happen. I mean, there's a genetic component, of course, right? We see it where mom and grandma both have diagnosed hypothyroidism and daughter has hypothyroidism as well. So it's very, very common for family history. And this is a condition that is what's going on, right? But there's lots of other factors that there's correlations to. One can be the toxins that we're exposed to. We, as lots of people I'm sure on this webinar, live in the city of Calgary, right? We're exposed to lots of toxins all of the time. And those toxins can mess with how our body converts that T4 to T3. Heavy metals are another big one, specifically mercury amalgams or mercury exposure. So mercury amalgams, I mean dental amalgams, or when you had cavities. This is generally in the older population because we don't tend to use mercury amalgams anymore in dental practices. But that can be a small amount of exposure to mercury, and mercury can actually bind to the thyroid and cause it not to function properly. So heavy metals is something that can be a root cause of low thyroid function. And ultimately, once you start to chelate or detoxify those heavy metals, detoxify toxins, then we start to see thyroid hormone kind of come back online.
Yeah. So you were talking about toxins. What are some things other than like the obvious air pollution? Is it everyday household cleaners, plastics, tap water, things like that? Can that all affect the thyroid?
That can all affect the thyroid. It can all affect female hormones too. So when we think about different things that are hormone disruptors is essentially what we call them. But exactly, you kind of nailed it, Leanne. So our tap water can affect it. So drinking filtered water is much better in terms of not having that kind of exposure. Pesticides can change how we produce our hormones because those are toxins that are on some of our foods. So buying your foods from community natural foods is a really good idea, right? Making sure that you're buying organic. Especially with the dirty dozen, those foods that we know are so heavily pesticide sprayed, making sure that those are organic is really important. Other things, some medications, those heavy metals like we talked about, and then cleaning products too. So cleaning products where you know that there's that kind of a really intense odor with them, those are chemicals that we know can disrupt the way that we produce our hormones. So making sure that you're switching to more clean cleaning products, environmentally friendly cleaning products, and cleaning products that don't contain a bunch of chemicals in them. Method is a really, really good brand that I know of just off the top of my head. But there's lots of them out there that have now switched over to products where these are not harsh chemicals that we're using to clean. So we're reducing that exposure, which is really good.
Yeah. Even, I find it interesting, like makeup products or perfume, or even a lot of women don't think about sanitary products. Like if it's not an organic cotton, they found glyphosate in tampons, right? Like things like that you probably wouldn't even think of. But obviously there's so many things and we can't kind of shut ourselves into a bubble in this world. But just kind of like minimizing that toxin overload the best we can, for sure.
Totally. And just being kind of conscious of what you're putting on your skin, what you're putting into your body, right? Nobody's perfect, right? And we're going to be exposed to some things, but if we can take the steps to mitigate some of those toxins that we know can affect hormone production, shampoos, conditioners, body lotions, those kind of things are big ones too. And women much more so than men, but women put on about an average of 20 products before we leave the house in the morning. So there are many different things within that. And if those are all from chemical bases, then that could really severely affect the way that our livers are able to detoxify our hormones, which then we can notice hormonal imbalances from there.
Right. So what, in terms of diet wise, if we have thyroid issues, what are kind of, I don't know if there's like an ultimate diet to follow, but what are some kind of things to help support the thyroid?
Totally. So there's four big nutrients that we need to think about when we're thinking about thyroid. Now, thyroid hormone, there's iodine in the thyroid hormone that is produced. So iodine is an important nutrient that we can get from things like seaweed, as long as it's from a wild crafted source, because seaweed can be full of mercury, which is not good for the thyroid. So As long as we're getting it from a reputable source, then that is good thing to incorporate into the diet in terms of getting amount of iodine. We generally need about 150 to 300 micrograms of iodine a day, which we can get from seaweed. That's a really good way to get it in. Some fish can be a good option too for that. And then two other things, zinc and selenium are super important for, again, that conversion from that T4 hormone that's inactive to the T3. That conversion relies on zinc and selenium to happen. It also relies on iron. So making sure that getting iron-rich foods into the diet, as well as foods rich in zinc and selenium. 2 Brazil nuts a day gets you all the selenium you need. So that's a really good option in terms of your selenium intake. Zinc, beans, lentils contain a lot of zinc, as well as meats and some dairy products if those are a part of your diet. But beans and lentils are kind of the mainstay in terms of vegan or vegetarian sources. And then iron, same kind of thing for vegans, vegetarians, a little bit harder to get that high amount of iron from one sitting. But your spinach, kale, beans, lentils, those all contain iron and are iron-rich foods. And then, of course, your meats are going to have lots of iron in them as well. But those are vital. And so if underlying iron deficiency anemia is going on, then we can see low thyroid function as well. And really the root is that iron deficiency anemia, not allowing that conversion to happen properly.
What about kind of that zinc copper ratio? Is that something to be mindful of as well?
Definitely something to be mindful of. The zinc copper ratio is really important in terms of our energy pathways in our cells. So copper is less important for thyroid function specifically, right? It's not necessarily a cofactor in the conversion of thyroid hormone, but copper is vital in how we process through the energy pathway. Zinc, copper, iron again, and then actually sunlight. So those energy pathways rely on chromophores, which are sunlight, that are activated by sunlight, I should say. And so getting sunlight into your eyeballs is what stimulates that pathway to happen, right? But if we're taking just a bunch of zinc and we have no copper in our bodies and we have that zinc copper imbalance, then that essentially we're asking a car to go without any oil, right? We don't have the cofactors in order to actually allow these pathways to work properly. And so it's not just supplementing with a bunch of zinc and selenium, right? Because we know that there's other reasons that zinc is used in the body, and same with selenium. And we don't want to overload those and not have enough of other cofactors that are needed for different processes in the body. So I generally recommend getting these things through diet, right?
Yeah.
Because then we're not going to overload the system, right? We're relying on our gastrointestinal tract to absorb those. And if we're eating exorbitant amounts of foods with zinc, we're probably not going to hit the level where we would start to get that zinc copper imbalance. But as a lot of us have seen in the research for COVID, zinc is really important, right? In terms of helping to get over COVID quickly. But now we're seeing a lot of zinc copper imbalances because we've been overloading with zinc for the last 2 years.
Right. Yeah. Usually you would take maybe like a break, like 3 months on or something, and then.
Totally. Yeah. Or take it while you're sick to get over that illness, but not something every day long-term.
Yeah. Now with iodine, I thought for people that have Hashimoto's, to take like an iodine supplement is not good. Is that true?
It is. Yeah. So Taking too much iodine can trigger hyperthyroidism, which in Hashimoto's thyroiditis, because there's that waxing, waning thyroid function, because the thyroid is actually being attacked by the immune system, we can actually trigger another event where you move into a hyperthyroid state. So you need to be really careful in terms of adding in things like tons of seaweed to the diet, or adding in an iodine supplement when you're in that state. And so again, it kind of comes back to that foundational, we test, right, to understand, are those antibodies present?
Right.
If they are, then we understand, okay, for someone with Hashimoto's, iodine is not something we're adding in.
Yeah, I think I just remember when I worked in this store and speaking with people, a lot of supplements are a blend, right? They have iodine and then they're like, oh yeah, I'll take this. But yeah, there's those little things, nuances. And that's why getting tested is so important, and working with a practitioner to make sure you're actually getting what you need, and then not taking anything that's going to further kind of mess up the thyroid. It seems to be very individually personalized, as well as very finicky. Even with iodine, it seems like even the smallest amount can trigger something.
Mm-hmm. Yeah, definitely. And just because, right, it's dangerous to be triggered into a hyperthyroid state, right? That is a medical emergency. You don't want to be doing that, right? It's a really big stress on the body to trigger into that. And so you want to be careful in terms of how much you're supplementing with different things that could potentially trigger you in there.
Yeah, absolutely. Just kind of continuing with diet, talking about nutrients. I think, again, speaking with women, not eating enough, I find, is a big problem. You know, whether they're doing keto or specific diets, not getting enough nutrients seems to be a crucial thing for a lot of people. Is that something you see as well? Just getting like enough food in the day, calorie wise?
Totally. Yeah. And I see this a lot with people who are really stressed, in that sometimes stress can turn off the appetite, right? So we don't feel hungry throughout the day. And so maybe I'll skip breakfast, maybe I'll have a little snack for lunch, and then I'll have something at dinner, kind of thing, is a pattern that we can get into, right? And then all of a sudden you're not getting all the nutrients that you need. And nutrients being all of our nutrients, right? Like B vitamins, magnesium, calcium, zinc, selenium, you name it, right? We need to get all of those things from food, right? And these are essential things that we need to eat, and we need to get the amount of protein and carbohydrates and fats within our diet so that we have enough of those energy producing molecules, right? If we don't eat enough, our thyroid function will drop off, because the body is in a mode of, I don't need to burn a bunch of calories right now, right? It's in a hypometabolic state. If we're not eating enough calories, it's not able to move through the energy pathways properly. And then we don't want to stimulate more those energy pathways to move, or that metabolism to occur, right? And so thyroid hormone will actually decrease if we're not if we're not getting enough nutrients within our diet. And that kind of moves us into that famine state, right? Where we have a stress on the body because we're not getting enough nutrients. And then there's cortisol dysregulation. That stress hormone is blocking the conversion to that thyroid hormone that is active. And with that, then our metabolism kind of shuts down.
Yeah, absolutely. What are your thoughts on kind of more of this EMF exposure? A lot of us are inside or working on our computers, on our phones, TVs, kind of that combination of blue light. Does that all kind of, or I guess it's quite new in terms of maybe being problematic. So is there more research on that that you're familiar with that can affect the thyroid?
I haven't seen specific research on low thyroid function with blue light, but it certainly makes sense in terms of theoretically. Right. So when we think about blue light, like the light that we're all looking at, right, by looking at a computer right now, when we look at our phones, that kind of stuff, that blue light stimulates cortisol production. So that's our stress hormone, right? And so later on in the day, that becomes problematic. Not so much a problem in the morning, right? We want our stress hormone nice and high, and then we allow it to slowly peter out throughout the day. And that's really important for us to have the amount of energy that we need when we get out of bed in the morning, right? And to get all of our stuff done throughout the day. But if we keep looking at screens once the sun has gone down, we're continuously being exposed to that blue light, and our brain has no trigger or mechanism to shut off that cortisol production. So we're continuing that cortisol production. And again, that can affect that thyroid hormone conversion, but it can also affect the way that we secrete our melatonin at night. And melatonin, that's our big sleep hormone, right? Lots of people supplement with melatonin, which is fine short term, but if we can get that natural melatonin secretion to occur by getting away from the screens once the sun has gone down, that natural melatonin secretion allows us to go to sleep, get that restorative sleep so that cortisol can be produced again properly in the morning. And that kind of natural cortisol rhythm is really important, like we talked about, for that conversion of the thyroid hormone. Whereas if we are constantly producing our cortisol, we're not going to convert thyroid hormone properly, and then we start to see all those signs and symptoms of low thyroid production.
Yeah, for sure. You had mentioned kind of the gut microbiome. So in regards to the thyroid, we need our digestive system working well and absorbing nutrients. So what are some common things? Like, do you typically tell people to avoid gluten or dairy, anything like that?
Yeah, so especially with Hashimoto's or any kind of antibody production, gluten is out of the diet. And that is because gluten actually has what we call molecular mimicry, meaning that it looks the same as the thyroid peroxidase antibody that is elevated in Hashimoto's thyroiditis. And so it can further perpetuate the symptoms and further cause destruction of the thyroid hormone. And so gluten being out of the diet is vital for that. There have been some studies that can't necessarily say that there's cause and effect of different bacteria in the gut microbiome triggering or causing low thyroid function, but that H. pylori, which is a really, really common stomach, primarily infection in the gastrointestinal tract, there has been a correlation between the development of autoimmune conditions, autoimmune thyroid conditions, and having that H. pylori infection. So another kind of indication that if you have something going on in that gut microbiome, there's dysbiosis or bacteria that shouldn't be in there, we can see kind of a trickle down effect in terms of we're not absorbing our nutrients properly, and therefore we're not able to do make thyroid hormone properly and convert it properly. Another thing too is, like we talked about with hypothyroidism, there's the constipation aspect to it, where constipation, if we're not clearing our bowels daily, we can essentially have a backup, and then bacteria start to build and grow and can grow out of control. And so something called SIBO, or small intestinal bacterial overgrowth, and thyroid hormone or low thyroid function are really, really commonly associated. So we'll often see, because of that slow transit time, we start to see this buildup in bacteria. And then that buildup in bacteria can cause bloating. It can also further perpetuate constipation. And so then you're kind of in this vicious cycle of the low thyroid function, but also the bacteria within the gastrointestinal tract are further contributing to the symptom.
Yeah, absolutely. That just made me think of, like, soy seems to be so controversial, like, especially when it comes to gut health, you know, talking about lectins or like other anti-nutrients. You know, you're mentioning lots of legumes. As long as they're prepared properly, they don't seem to be an issue. But things like soy, do you typically tell people to remove that from their diet as well, or?
Soy, I'm okay in moderation as long as it's from an organic, non-GMO source.
Okay.
So I don't see a ton, and some soy can actually be good for thyroid function and can help to promote thyroid function. So it's not that soy necessarily is bad for all hormones, right?
Right.
It can perpetuate some estrogen dominance symptoms, which is much more of a female hormone concern, which we'll kind of definitely do a deep dive into in our next webinar. But
Yeah.
in terms of soy with thyroid alone, not a huge concern in terms of having that incorporated into the diet. It's not something you want to eat every day though, right?
Yeah.
Only having tofu or tempeh as your source of protein, we need to mix it up. So getting different sources like beans and legumes, as long as those are prepared properly so that it's easy on the gastrointestinal tract to digest, those are good sources of those nutrients, right? But they have to be prepared in a way that we can actually break them down, because otherwise they can wreak havoc on the guts, as I'm sure some of you have experienced before.
Yes. Lastly, kind of the cruciferous family. We were even taught in school, like, to avoid raw, like broccoli and things like that. Is that something you would agree with as well?
Definitely. Yeah. So those are those big, what we call goitrogenic foods, meaning that they can affect the way that we produce our thyroid hormone. So they can actually cause a goiter, which a goiter is when your body is not producing enough thyroid hormone and your thyroid stimulating hormone is telling the thyroid to produce a ton. And so you actually get swelling around your thyroid gland. That's called a goiter. And that is kind of a telltale sign that there's diagnosable low thyroid function, right? Further testing, of course, confirms that, but cruciferous vegetables are goitrogenic, meaning that they can lower thyroid function. As long as you cook them, that goes away. So if you eat cruciferous vegetables cooked, that's okay. Those are not goitrogenic, but if you're eating them raw and only raw, that is a problem in terms of if you have underlying low thyroid function, that's going to further perpetuate that. So as good as those foods are to eat, we do have to be careful in terms of, again, the way we prepare them and also how much we're eating. I often recommend cruciferous vegetables in the diet because they are so important for female hormone metabolism, but recommending them cooked, not raw, because of that factor with the thyroid. And because thyroid hormone and female hormones go hand in hand, we want to make sure that we're not causing low thyroid function that then is affecting those female hormones.
Right. I think you mentioned Synthroid. That's quite like a common pharmaceutical prescription. Is there a time and a place to use Synthroid versus maybe, a desiccated thyroid or a glandular supplement?
Definitely. So, Synthroid is pretty first line in terms of if you have an elevated thyroid stimulating hormone, meaning that your brain is having to tell your thyroid to produce a ton of thyroid hormone, and you have low active thyroid hormones with T3, T4, this is generally the first line medication that is offered. And it works well for most people. The only problem with Synthroid is that Synthroid is T4. So it's that inactive thyroid hormone that we're replacing. We are still relying on the peripheral conversion of thyroid hormone T4, which is Synthroid, to that T3 hormone, which is the active one that, again, binds the cell. So if somebody is not feeling well on Synthroid, they're not noticing changes and they don't notice any difference while they're on it, first line, again, is probably increasing the dose. Now, me as a naturopath, I can't prescribe medications, of course. So this is through medical doctor. But if the Synthroid is not effective because peripheral conversion is an issue, that's where desiccated thyroid can be really, really helpful. And what desiccated thyroid is it's a combination of free T4, which is that inactive thyroid hormone, and a little bit of T3, which is that active thyroid hormone. And so you're actually getting the equal ratios of T4 to T3 from what your thyroid actually produces. So it's exactly mimicking how your thyroid releases thyroid hormone. And so that can be really helpful if Synthroid isn't working.
Right.
But generally, kind of first line is that Synthroid, and then considering switching to something else. a benefit again of that desiccated is that it mimics what our thyroid actually does, which is great.
Right.
Again, it's not for everybody, right? This is a conversation in terms of finding the best medication based on the lab work, right? If you can see that your T4 levels look really good, but you do have that low conversion, potentially starting with helpful things to help convert T4 to T3 is the best way to start, right? And then determining if medication is the way to go in terms of that, from the desiccated versus synthroid. A glandular is an option for sure. And what glandular is it's essentially thyroid gland. So similar to adrenal glandular, this is just a piece of thyroid. It's usually from porcine or pig, but essentially you're taking that thyroid gland, which can again help to promote that thyroid T4 and T3 release. That usually not as powerful as a medication, right? It's going to help promote normal production of the thyroid and release of the thyroid hormone from your body naturally. It's not going to actually just replace it like what a synthroid or a desiccated thyroid would do.
Right. And you kind of mentioned that conversion. So that conversion happens in the cells and the liver, correct?
It does.
Yeah. So I guess for some of these supplements and then adding in nutrients and other things, would this be like a short-term thing to kind of kickstart the thyroid, help you feeling better, and then eventually it's okay, let's get more to like the root, why aren't we converting, that sort of thing?
Exactly. Yeah. So generally I'll use supplementation essentially, like you said, Leanne, to help kickstart, right? To get that thyroid producing that thyroid hormone properly. But again, if we don't get to the root, if those heavy metals are still floating around in the body, if we're still being exposed to a ton of toxins, if we have iron deficiency, zinc deficiency, selenium deficiency, there's a whole host of reasons, right? In terms of why that thyroid could be low. Cortisol is too high. If we don't get to those roots, it comes back once you come off the supplementation, right? And so it can really help in terms of helping to produce the right amount of thyroid hormone in the interim, right? Get you feeling better so that those diet lifestyle factors are actually sustainable, that help reduce the likelihood of this coming back or happening again.
For sure. All right. Well, looks like we have a ton of questions, so which is good. Okay, let's just pull some of these up. All right, so I'd love to hear some information regarding thyroid and arthritis. So I guess, is there like does one cause the other, or is there a correlation between the two?
That would depend on what kind of arthritis we might be dealing with, but certainly makes sense in terms of if our thyroid hormone isn't producing enough properly and there's underlying concerns with how your gut is absorbing your nutrients that are involved in that thyroid production. We can also have changes in terms of how we're absorbing the nutrients that are really important for joint health. So if it's osteoarthritis, it can kind of start again in that root cause of the gut. And then we can see both low thyroid function and osteoarthritis kind of go hand in hand, if that makes sense.
Yeah, for sure. Can you give us a summary of what appropriate levels would look like in terms of numbers? So for blood work, TSH, T4, T3, et cetera.
Totally. So there are different ranges out there. So there's US levels versus Canadian levels. I will tell you about the Canadian levels because those are the ones that I'm most familiar with. But generally a TSH below 2.5. So the TSH reference range is 0.5 to 4. I usually want to see it between 1 to 2.5. That's kind of ideal in terms of the amount of TSH. So again, that's a really, really big reference range, right? And we can have all kinds of low thyroid symptoms with a TSH above that 2.5 range. For T4, I usually want to see anywhere in that upper third of the reference range. So the reference range, I believe in the Canadian values, goes to about 25. It's 10 to 25. I usually want to see anywhere between 18 and up. Okay. And then in terms of free T3, again, the reference range, I'm sorry, I can't remember the exact numbers, but I believe it's 3.5 to 5.5. And again, that upper third of the reference range is where I want to see people. So in that kind of upper third is optimal, right? So from 3.5 to 5, or sorry, I think it's actually 6.0. So above a 5 is what I'm looking for with that. And then antibodies, there is a cusp in terms of less than an amount of antibodies. You're not going to be flagged as having too many antibodies. It's normal to produce sometimes a little bit, right? Our immune systems are always active. It's when they go too high that it becomes a problem. So anything less than a 35 does not flag for Hashimoto's or that anti-thyroid peroxidase antibody.
Awesome. What about kind of thyroid issues and loose stools? Is there a correlation?
Definitely. So if we're thinking about just thyroid from a metabolic state in terms of it stimulating bowel movements and causing metabolism to occur, when our thyroids are functioning too much or there's too much thyroid production, we can notice diarrhea. So really, really frequent loose stools is a really common concern. If diarrhea is associated with those low thyroid symptoms, again, likely related to that gut microbiome or potentially some kind of food trigger that is causing that. Where again, we can see those low thyroid functions because we're not absorbing our food properly through our gastrointestinal tract, but we also have loose stools because we're not absorbing things properly through our gastrointestinal tract. So we're not actually digesting foods. We're seeing lots of food that comes out in the stool, right? So that undigested food, meaning that you're not actually breaking down your food properly.
Awesome. What is the best thing to take if your T3 lab work is low?
Again, kind of depends on what the other lab work is looking like. So if your T4 is normal and your T3 is low, big things are getting that zinc source, selenium source, and iron source into the diet, as well as considering some stress management. If stress is really, really high and that cortisol is blocking that conversion from T4 to T3, then addressing that. So meditation practices, exercise, things like that can be really helpful in terms of stress mitigation techniques, and making sure that those are kind of mainstay of diet lifestyle factors moving forward can be really helpful for T3 to get that conversion working properly.
Perfect. Are calcium and fish oil beneficial for Hashimoto's?
Fish oil can be, yep, because fish oil is a general anti-inflammatory, which we know in Hashimoto's because there is that immune system component or that immune system activation, that it can be inflammatory, right? So more inflammation. Calcium, not necessarily the best thing for Hashimoto's thyroiditis. More so focusing on removing gluten from the diet would be a mainstay treatment for that one.
Okay. Can a person have Hashimoto's even though their antibodies are normal, like as well they're having symptoms of like Hashimoto's?
Interesting. It could. So if your antibodies were elevated previously, meaning that this may have happened years and years ago, that the thyroid was attacked and now it's all shriveled up, that could have happened a long time ago and there was antibody elevation previously. Now, because of the waxing, waning nature of Hashimoto's, it's really common to see those antibodies change, right? And then as you focus on kind of dietary factors with that. If you're removing gluten from the diet, we're focusing on anti-inflammatory foods, things like that. We're decreasing overall inflammation. Our goal is to get those antibodies into a normal reference range, right? We want to reduce that inflammation and not have things attacking the thyroid. So I don't know for sure, but it's potential that it happened a long time ago.
Yeah. Yeah, I just see a few really like detailed questions. And sorry, I think at the beginning I didn't mention your name. Someone had asked. So Dr. Alexandra Smith, who works at Neurvana Health Clinic. So if you guys want to reach out to her in the email follow-up, I'll send an email to the clinic and you can reach out and work with her if you're interested. I just don't think we can answer too many specific personal detailed questions because like you said, you need to see more of what's going on. So just for a few of those people that had asked questions, if I don't get to them. Okay, so my antibody levels are sometimes as high as 600. I've been on Synthroid for 10 years. Should I be switching to something else?
So Synthroid doesn't necessarily reduce antibody levels. So if your thyroid hormone levels are coming back within the normal reference range, like the TSH, like we talked about below the 2.5, upper reference range for the T4 and upper reference range for the T3, not changing your Synthroid is probably not going to change the antibody production. Antibodies, again, that's that immune system part of low thyroid function. And so considering that gluten that has that molecular mimicry to antibodies, potentially some other concerns in terms of why the immune system is so active. Is there an underlying chronic infection, something like that? There's lots of different things that we can think about in terms of that. But it's usually not necessarily associated with just switching the medication from Synthroid to something else that's going to actually reduce those antibodies. There's something involved in inflammation that's causing that inflammatory reaction and that antibody production.
Awesome. What causes hyperparathyroidism? So we didn't really touch base on the parathyroid.
Mm-hmm. So hyperparathyroidism, this is a different concern, usually involving calcium and things like that. This can be an autoimmune reaction. It's not super common in terms of seeing that, but again, underlying inflammation, chronic infection, potentially heavy metal exposure. There's multiple different things that we can look at in terms of root causes for why that's happening. And then ultimately, figuring out what that underlying cause is can help to restore that. But that's kind of, it's a hard question to answer just because there's so many things that we can think about with that. I wish I could give a bit more of a detailed answer to that.
Yeah. Yeah, like these are amazing questions. Like I think a lot of it is definitely, there's too much to unpack here, yeah. Unfortunately. Okay, I'm just going to open up the Q&A.
Sure.
So if I have thyroid symptoms like feeling cold, missing outside eyebrows, tired, troubled with energy, should I be on thyroid hormone even though my TSH is 3.43?
So again, kind of in that upper end of that TSH, right? Like we talked about, I like to see that TSH below a 2.5. This doesn't necessarily indicate that a medication is necessary, right? But figuring out, okay, what are your T4 and T3 levels at? And is there concern with that conversion to thyroid hormone, the active one, that T3, right? Is there underlying stress that is contributing to this? Are there other hormonal imbalances that are potentially there? More information is kind of what's needed for really good answer for that question. But potentially a medication would be beneficial. But ultimately those kind of diet factors can be really, really helpful in this case in order to figure that out. Looking a little bit deeper, I think would be warranted with all of those symptoms on top of that really, really high end of the TSH.
So ferritin level of 61 and iron of 18. Are these numbers concerning? What is a good number for ferritin and iron?
Those are great. So anywhere from 50 to 100 is generally where I want to see ferritin, which is your iron store. So iron store means amount of iron in your liver. Ferritin higher than that can actually be inflammatory in the body. So it can increase inflammation. So that kind of 50 to 100 is the sweet spot. And an iron of 18 is great. So again, that's that kind of upper end of the reference range for iron, meaning that you likely have enough iron to do all the processes that you want to. So that is good.
Okay, awesome. Oh, sorry, the sun is making it hard to see. So what exactly causes Hashimoto's?
So Hashimoto's, again, there's lots of different root causes for what's going on with that, but Hashimoto's is an elevation of those antibodies. And so that's anti-thyroid peroxidase is usually the one that is elevated in Hashimoto's thyroiditis. Less commonly, something called thyroglobulin antibody can also be elevated, but Hashimoto's is diagnosed by having elevated antibodies. So meaning that something, your immune system is attacking self and it's attacking the thyroid.
Perfect. Have you heard of the supplement called Thyroid Fem? Can I take this long term?
Not heard of that one. Thyrofem, I feel like that's maybe an AOR product. I would honestly have to look that up to confirm that if that is okay to take long term. There are lots of different thyroid supplements out there, so I'm sorry that I don't know the name exactly of that one.
So as a naturopath, can you refer for a complete blood panel test? And do you work together with an MD to kind of get the complete blood work?
So I offer blood work in my clinic. And so we do all of our blood draws in-house at Neurvana Naturopathic Medicine. And so that's generally how we do full thyroid panels. Within the AHS system, if things aren't out of range, they're not allowed generally to test further. So it is a conversation that with your medical doctor or primary care provider that I am happy to have a discussion with if we can get that testing done through a medical doctor, but it is something that I offer just through my clinic.
Perfect. So my thyroid got worse in menopause. Why is this?
So in menopause is interesting because you've stopped ovulating, meaning that you're not releasing any more eggs. There can be a lower amount of thyroid production. So our thyroid is really, really important for ovulation to occur. It's also really important for what we call the corpus luteum, which is the small sac that's left behind after you ovulate. That's what produces your progesterone. And so when you stop having that natural process of ovulation, where because that egg has been released and then we need thyroid hormone in order for that process to happen properly and produce our progesterone properly, no longer having that progesterone feedback, we can then start to see lower thyroid function from there. So it's overall kind of all hormones are decreasing after menopause, and then we can see low thyroid as well. It's not always in menopause that we'll see that, but it does happen quite commonly with menopause.
Is low sex drive a sign of low thyroid?
It can be for sure in relation to that kind of low energy. We can see a low sex drive along with that. There are other hormones, of course, that can be a sign or a cause of low sex drive. So low testosterone is a big one for women that I see, where we're just not producing enough in order to have a sex drive or have libido. But low thyroid from a point of low energy and then low sex drive for sure.
What about fluoride? I don't know if it's been added yet, but I know it was approved. Does that negatively affect the thyroid?
It can, because fluoride has, again, that +2 charge that a lot of our nutrients that are important for thyroid production have. This is kind of in a similar way that heavy metals affect the thyroid, where it can actually bind to the thyroid gland, and then it decreases thyroid function over time. So fluoride can be a concern. Filtered water is kind of the best way to avoid that.
Is it possible to correct your cortisol level?
Absolutely. Yeah. Ultimately figuring out where that high stress or cortisol level is coming from, or if it's really low, and helping to add in those diet lifestyle factors that can significantly help with cortisol production and the proper cortisol production. So that curve that we kind of spoke very briefly about, but big spike in the morning that slowly peters out throughout the day. One of the best things that we can do in terms of adding something into our lifestyle is sun exposure right in the morning. So sunlight right when you get up in the morning, getting sunlight into your eyeballs, not through a window, can be really, really helpful in order to stimulate that cortisol production and actually get those energy pathways, like we talked about with the iron, copper, and zinc, going, because those rely on sunlight. So sunlight exposure is the number one thing in terms of a lifestyle a lifestyle change that can help in terms of producing the right amount of cortisol at the right time throughout the day.
Yeah, absolutely. So I'm doing all the correct practices for thyroid health that you mentioned. Why would my TSH numbers still be off? And why would I still have thyroid symptoms?
So sometimes low thyroid function is the diagnosis, right? So you have low thyroid function and you potentially, your body just doesn't produce the right amounts of thyroid hormone. So that can be a reason, right? There can be root causes to thyroid. There can also be thyroid conditions, right? So there's potentially that there's that going on. Potentially there's something else contributing to it. Potentially stress or that high cortisol, like we talked about, some heavy metals that potentially are affecting the way that you're producing your thyroid hormone. Again, there's so many ways to answer that question. It's hard to know without knowing someone's health history in terms of what those contributing factors could be.
Okay, so I ate tofu and soy milk every day in the 90s. Could this have caused thyroid damage?
I don't know the answer to that question 100%. There's a potential, right, where if it was a food that you were reacting to in terms of increasing overall inflammation, and that inflammation had a specific target for your thyroid, then maybe that could have contributed. It could also be a lot of other things that could contribute to low thyroid function. So there's a potential there, right? We know soy, if it's eaten all the time, it can be an inflammatory food. It can also mess with hormone balancing. More specific towards that estrogen dominance that I very, very briefly touched on, than thyroid specifically, but it can still cause overall inflammation that could potentially have affected thyroid.
Do you have time for one?
Hit me.
I think so. We didn't really touch on males. So do males have similar problems with thyroid?
They can for sure. It's just much less common. So we see it much more common in women with thyroid concerns, but men can absolutely have low thyroid function. Men can absolutely have high thyroid function as well. It's just a common condition that's more often seen in women. But sorry if any men on here feel like they've been excluded from the conversation, because it absolutely is a condition that can be seen in men as well.
Sorry, we didn't get to all your questions. They are very detailed. And so definitely reach out if you guys want to work with her. She's fantastic. And thanks again, everyone. And thanks again, Dr. Smith, for your time this evening.